Thank you, Scott, and good evening, everybody. Pleasure to be here tonight. Um, these topics that I talk about initially usually flow from stuff that's kind of in the ether out there in my world last couple of days. And both in clients and at webinars and meetings, it seems everywhere I go this week, people are talking about sort of the duration of certain withdrawal symptoms and how they can seem to go on and catch people by surprise, even well into recovery. And so I wanted to talk about a phenomenon that we call post-acute withdrawal syndrome. It's a specific phenomenon that we see quite a bit, whether it's drug addiction or sex addiction. The patterns tend to be somewhat the same. So, when we talk about post-acute, we talk about withdrawal per se from, let's say, drugs. There's an acute phase where people are actually going through withdrawal and detoxification, and normally that's the first 2 weeks of any withdrawal from any addiction is usually typically called acute because of the severity of symptoms. And by the way, even sex and porn addiction have withdrawal symptoms of irritability and mood swings and tearfulness and all kinds of other stuff too. They don't have physiological withdrawal symptoms, but they certainly have those. So after those initial couple of weeks, then there's a period of about 6 months that we have a bunch of symptoms that continue to occur. And I think this kind of takes people by surprise sometimes. And it occurs for both drugs and sex addiction. And so the 6-month piece is what we call post-acute withdrawal. It's not a medical diagnosis per se, but it's really a kind of a cluster of symptoms that's well recognized that is pretty normal for a lot of people. And so this is first, I think, observed in the 1990s for alcohol, and then we've started to notice it for other drugs and behaviors as well. And so what we also know is that porn withdrawal pretty much mimics amphetamine withdrawal. Amphetamine has no physiological detox per se. If you try to get your insurance company to cover an inpatient withdrawal from amphetamines, they're not going to do it because they're going to say there's no physiological withdrawal that's life-threatening. But we know that there's a lot of psychological complications that come from that withdrawal, and that we know that porn withdrawal is very similar. So what do we see? Within the first 48 hours, there's a lot of grumpiness, a lot of irritability, a lot of mood swings. We can go from tearfulness to being angry to being kind of elated, kind of all over the place. So people are bouncing around, and that's pretty normal. We can get headaches. There's a lot of anxiety that typically comes in, and craving. Craving is the strong temptation that we get. And remember, with these high intensity addictions like sex, porn, and chemsex, they really train the brain to really be highly sensitive to any kind of stimuli. So, for example, last couple of days, I've had guys talk about, several months into recovery, they get really easily and powerfully triggered by a visual citing someone or just being tempted in some way. And they were kind of surprised by the power of the craving well into recovery. So that's, I think, part of this post-acute withdrawal thing that we're talking about. 1 to 3 weeks post-porn, 1 to 3 weeks post-amphetamines particularly, there's sometimes we see like this zombie-like state. People get kind of numb. People get kind of a low-grade depression. We have a word called anhedonia, which is this inability to experience pleasure that's really largely due to a lot of the chemical changes in the brain structure that's going on. We see inability to focus. A lot of people although there's a high correlation of ADHD and these addictions, even if they're not diagnosed with ADHD, there's a really hard time to focus on things. And so people have a lot of trouble. People get socially awkward. Many times our addiction kind of fueled our ability to interact socially, gives us courage, reduce inhibitions. And so people start to feel really acutely self-aware. Oftentimes sex drive goes out the window, very low sex drive, and sometimes this profound sense of loneliness. And then days 30 to 60, we talk about these random temptations, outbursts of emotion. You can be fine, and suddenly something will trigger you, and you're in tears or indecisive, and so on. But as we get into the other kind of behaviors that we look at for post-acute withdrawal, couple things, there's a couple themes that emerge. One is irritability and hostility. Irritability, just, we know that when we're fighting cravings, when we're fighting temptation, we get pretty irritable with stuff because we don't have our medicine, right? We don't have our relief from whatever is causing us discomfort. But the other thing is hostility. And I think people get really pretty edgy sometimes in this state, because remember, our addictions really serve to separate us from and dissociate us or numb us from uncomfortable thoughts, feelings, and so on. And so when we don't have that blanket of comfort to wrap around ourselves, it causes, we're directly feeling all those feelings, and that causes a lot of edginess. Depression, I mentioned, but one of the things we typically see, and this is both chemically and kind of physiologically induced, but it's also just mood. But a lot of the changes we see in the brain from these behaviors really set us up for depression for the first couple of months, because they're all high intensity addictions. They've set our baseline of stimulation necessary to feel anything, but especially to feel normal or good, very, very high. So high that we can only meet them through addictive behaviors. And when we quit the addictive behaviors and start to practice normal life, our brains have to they have to catch up and kind of reset their, re-regulate, if you will, back to where we can get normal stimulation to feel okay. And while that's happening, people's moods can get really low. There's a depletion of dopamine. The brain isn't able to distribute dopamine adequately. And without dopamine, there's a real problem with mood. Now that does regulate after a while as the brain kind of, through neuroplasticity, is able to kind of rebalance, but there's a period that goes on. Depression is one, as I just mentioned. Anxiety about stuff. People tend to really start to feel a lot of feelings and nervousness, things, old thoughts and situations that were kind of smoothed over by our addiction become really kind of triggering, and there's a lot of anxiety that is caused not just by our internal state, but by external circumstances. Recovery usually comes with a price, and the price is that of our addiction, all the consequences. We may have relationship problems, we may have job problems, financial problems, legal problems, social problems, our support system, if you can call it that, our using friends or our addiction friends or our affair partners or all that stuff is, they've been pretty much cut off, or they should be. And that causes there's a lot of gaps in our life. The ways we used to cope with things are no longer there. And the new systems for coping with things in healthy ways aren't quite set up yet. And so we're caught in, again, in this gap. And this is where post-acute withdrawal really starts to fit in. Mood swings. We can go from feeling great, and there's sometimes we experience what we call pink cloud, where everything's kind of normal and fabulous, and we feel great. This is the best thing we ever did. And we can, tumble down from that pink cloud into the pits of depression, despair, or anxiety and tears by somebody looking cross-eyed at us. So there's a lot of inability to kind of regulate our moods. And these are skills that are also really important in early recovery to do what a therapist calls affective regulation, right? To control our emotions and feelings. Another one that is very common, low energy and fatigue. We're just kind of tired. And part of that is our body recovering, if you will, but part of it is being awake and conscious and dealing with the overstimulation of stuff in the world, right? I think when we're in our addiction, we're kind of not quite conscious. We're kind of not really taking in all the world and all its glory. And I think with sobriety, from sex, porn, or drugs, suddenly there's no buffer between us and the world. And so we can get highly stimulated by feelings. They can overwhelm our capacity to deal with them. And that can cause this kind of roller coaster of emotions that's pretty typical. Two more, and then I'll move on. Sleep disruption. I swore in my first 2 years of my recovery, I didn't sleep a wink. And of course I did, but it sure felt like I didn't. And I think sleep is one of those things that is highly dysregulated by our addictive behavior. And I think the best thing we can do is live with it. We want to avoid, I think, medications that induce sleep, because that's really still just an external kind of crutch. I think there's other ways, sleep hygiene, keeping your bedroom cool, even taking a warm bath before you go to bed, not watching the news, keeping your level of stimulation low, just starting really an hour before you start to sleep, starting to slow down and just get into that mood where you're kind of ready to sleep. And then finally, this kind of ADHD thing that writ large, right? This inability to focus, lack of clarity, kind of muddled thinking. It can be very frustrating for people. Very often we see, because of what we call disturbed or low verbal memory, that's a psychological term, but it means our ability to process cognitive information is disrupted. And so that's our ability for abstract thinking. So we can do well with concrete stuff, but if it gets too abstract, reading a book, reading a complex book, for a lot of amphetamine users, even the first month or so, trying to read the 12 steps and 12 traditions on the wall in a meeting can be kind of overwhelming because the words just don't make sense so much. So those are kind of the things. A couple other things: lack of libido. Very often our sex drive and our erotic desires are all tied up with our addiction and have also gotten kind of hijacked by the addiction. So when we move out of those addictive behaviors, our normal ways of getting aroused are really, really disrupted in a big way. And then chronic pain. And I remember my sponsor telling me, any kind of pain you feel is probably related to your addiction somehow. Just your body kind of working things out. Obviously, if it's serious, get it checked out. But I remember I had teeth pain. I had weird aches and joint pain, and they would kind of come and go. And one day I'd be here, one day I'd be on my knee, and just all over the place. And I kind of just, my body was kind of going through whatever it was going through, trying to recover from the addiction that I'd put it through. So given all that, and this is a normal thing that we do see, so what do we do about it? How do we manage these different symptoms? One, I think, is to really educate yourself about the withdrawal. That's why I take the time to do something like this tonight, because it's not over for a while. And I think a lot of times people come in, we have clients come into Seeking Integrity with sex and porn addiction, who really aren't prepared for the idea of any kind of withdrawal. Because again, there's no physiological withdrawal, but there's certainly a psychological withdrawal that occurs. And so that really, to educate yourself about what to expect, to manage your expectations, and to really, more importantly, I think, know what to do about it when these things occur. One thing I think is to focus on the positive, really to celebrate every positive step along the way. I think sometimes we can get so wrapped up in focusing on what's not working, on the problems, our aches and pains, our anxiety, our depressed mood. I think it's really important to kind of, take a step back. Addicts typically have what we call negativity bias, which means we kind of see it's the glass half full syndrome, right? We see all the problems, and this is not just, this is more than just what it seems, because it's actually a psychological thing where we've trained our brain to really see and focus on negative information. We have to really try to convert that into noticing at least half the time stuff that's going right. And it may seem like nothing's going right initially, but that's why we have, Scott, my favorite tool, which is gratitude list. I think if we can, even if we're feeling like crap, if we can sit down and do a gratitude list, and that may be a struggle, because I've had clients say, what can I be grateful for? There's always a lot to be grateful for. If nothing else, then you're sitting here breathing, thinking about this problem, right? Where a lot of addicts are not. And so I think to really focus on gratitude, for me, it's like an instant mood changer in a good way. It really kind of tempers any foul mood I'm in. If I can really get in touch with gratitude, it's kind of a detoxifying agent for me. So I think really focusing on the positive, using gratitude as a tool to get you there, and really focusing on that. Patience. One thing we do not have is patience. And I think learning how to have patience, especially, by the way, for sex and porn addicts and chemsex addicts, this is all about intensity, stimulation. We don't like boredom. We don't like empty space. We don't like downtime. We got to be busy. We got to be stimulated. And so patience is like anathema to a lot of the way we function. So I think learning how to sit with discomfort, learning how to sit with uncertainty, learning how to sit with an hour of free time and use it productively instead of thinking about, porn or sex or acting out, or how you might take advantage of this moment in your life where you may not be accountable to anybody for a brief period of time. So patience is a really huge skill. Boredom is not our friend here. Boredom is something that really is very triggering for people for just the reasons I mentioned, the need for stimulation, the need for all that. Natural ways to deal with sleep. I'm over time, so I'm going to speed it up. Exercise, healthy diet. Exercise is a marvelous thing, not just for your health, physical health. It really is a great way to manage moods. It's a great way to speed up the healing of your brain. Exercise produces these amino acids that are actually the building blocks for a lot of the reward circuitry that's been damaged by our addiction. So exercise is great. Watch for co-occurring disorders that may emerge or reemerge. So say you're a sex and porn addict that dabbles in cocaine, right? Suddenly gambling might seem like a kind of cool thing to do, or gaming, or work, because we can transfer all that addictive energy into something else. So really be alert to that. It's a big risk for people. And then finally, connection. We keep coming back to that over and over again. But if we don't have that connection is the methods by which we receive our healing, right? We have to do it with other people. That's the means by which we get all the information and the support and the love that we need. And by the way, it's a two-way street. We can give it back. And that really is the essence of recovery. So with that, I'm going to stop, but just be alert to post-acute withdrawal syndrome. It's a big one. Thanks. Thank God.
Thanks, David. Type your questions into the Q&A feature. We'll get to them as quickly as we can. I have a couple questions about post-acute withdrawal symptoms. Does everybody experience it, or just some people?
It's hard to say. I would bet everybody experiences it to some extent. I've seen some people that had a whole lot more problems with it than others for reasons I can't say, but I think everybody has sleep problems. Everybody has mood swings. Everybody has anxiety. Everybody has some depression. When it gets to the chronic aches and pains, or the prolonged serious depression, or really bad impulse control, that kind of stuff may vary by individuals, but I would say everybody gets it, but to a greater or lesser degree.
Thank you. Which brings me to my next question. You mentioned you're not a big fan of meds for sleep, but you also mentioned one of the post-acute withdrawal symptoms, or a couple of them, are depression and anxiety, potentially anhedonia. These can be pretty serious. Do you recommend meds, or at least limited time meds for those issues for some people to help them through the PAWS?
Yeah, that's it. Thank you. It's a really great point to clarify, because we do know that some of the withdrawal from these intensity addictions, meaning the sex, porn, and amphetamines, can really be quite severe. And a lot of the brain circuitry can be disrupted. So in some cases, an antidepressant is a perfectly fine addition to the recovery plan, in my opinion, because it just keeps the bottom from dropping out from under. I think working with a physician who knows addiction and who knows what to prescribe and what not to prescribe, because there are certain things that can help that are not mood altering, and there are others that certainly are. And so I think, for example, anxiety, if anxiety is really bad, there are non-mood altering medications for anxiety, as opposed to like the benzodiazepines, which are highly addictive and really dangerous for people. For sleep, I do know people in recovery that do melatonin or trazodone. I think if you get into the more high-powered sleep medications, I think that's probably not recommended in my book. But I would sure try to sleep without it. Try herbal teas, try relaxation, try all the sleep hygiene stuff. And if that's really not working, I'd talk to, again, a doctor that might know about addiction to talk about safe alternatives. But yeah, in certain cases, for sure, things can help.
Yeah, let me reiterate what David just said there, or at least part of it. Talk to a doctor who understands addiction. Not every medical doctor is up to date on addiction, and a lot of them just throw meds at problems, and they don't understand that for addicts, that in itself can become a huge problem. It can create a whole new problem.
Right.
And you can do it really easily. So make sure your doctor knows you're in recovery, and understands what recovery means.
And even then, we have to really be on our guard, because my own doctor, who I really like, knows I'm in recovery, but he'll still offer me stuff sometimes that I don't need or want. And so I think doctors just kind of do that because that's what they do. But I think so it's really the responsibility is up to us to refuse and have try to educate everybody as we go.
Yeah. So a couple more quick questions, hopefully quick questions for me. How long does post-acute withdrawal typically last? I know you mentioned one of the things we have to do is be patient. I'm assuming we kind of have to let the brain heal so that, all of our reward system stuff, it needs to get back to normal so we can start to experience life in a normal way.
Yeah, so the typical range is up to 6 months, which seems like a really long time for people if they're experiencing this stuff. But that's kind of what it takes to get the brain and the body kind of evened out. If these kind of symptoms persist beyond that, I think that requires maybe a talk with a professional sometime to see what's going on. There's some other issue, but I think for most people, sooner than 6 months, they won't be experiencing these. But I don't think it's unusual if it does go up to 6 months. And by the way, I think with the exception of sleep, because I swear to God, my sleep problems went on for I'm not exaggerating, 2 years.
Yeah, I had
That's so long ago. I think I
year and a
probably
half of permanent, I started saying amnesia, but that's not what is it when you can't go? Insomnia. There we go.
Insomnia.
I did not have an amnesia. I had insomnia. Okay, let's get to our questions. The first thing that came in the chat feature, and they asked about headaches as a symptom of withdrawal and post-acute withdrawal.
Yeah, so definitely headaches can be right in there. I think part of that is stress related, honestly, as opposed to any kind of physiological result of the addiction. But I think headaches are very common. So I think I would just advise you, most of us kind of know where our headaches typically occur. And I think sometimes we just have to kind of watch that. If your headache patterns are really unusual or different, again, then I would check it out with the doctor. But I think headaches are a really common feature of this. Our brains are, whatever metaphor you want to use, thawing, waking up, and there's a lot of stuff that goes on. Also, headaches are generally a stress response to stuff that we're going through. Yeah, and I mean, recovery is stressful, early recovery especially, because we got anxiety, we got the consequence of our addiction, we may be dealing with a troubled marriage or job consequences, or there's all kinds of stuff. And so I think a stress headache is probably very common for sure. And by the way, stress in other parts of our body as well. I think it's really important to know your body, know where you carry stress, and kind of be alert to that as you feel it.
And this goes back to your first item, educate yourself, and educate yourself about, I know what different headaches mean, and I know what, where my stress lives and where my anxiety lives.
Right.
Physically, I know what those sensations mean to me. And it doesn't mean that my head's going to pop off because I'm not acting out today. It just means I'm stressed out because I'm in recovery and, and I'm still looking down the barrel of consequences, and I don't, my coping mechanism is gone all of a sudden. And I'm trying not to drink or get high either. And it's like, oh my God, what do I do? And I don't know. Because as you said, we haven't developed those new and healthier coping skills yet.
Exactly. And one thing I was just realizing too, when we're in early recovery, we may not know what's normal for our body. As I recall, I didn't know. I was sort of so numb and had my own physical consequences of my addiction, but I didn't know kind of what was normal. So part of it may be just kind of a learning process too, to really discover that about yourself, where you have stress headaches, where in your body stress tends to show up, and so on.
Okay, so next question here, can you still go through withdrawal if you're still watching, I think autocorrect turned the word porn into ornament, so I'm going to assume that's porn. So can you still go through withdrawal if you're still watching porn, but you've stopped sexing and seeking out in-person encounters? So can you go through withdrawal if you're still watching porn, but you've stopped your other behaviors?
Right, so yeah, absolutely. The thing there, though, if you're watching porn, you're still kind of medicating yourself at some level, and depending on how much porn you're watching and what part of that pattern it was, to me, just stopping those other behaviors are just a portion of it. And I would be cautious about that strategy. I'm not sure what you're doing, if you're trying to phase out or just that's your kind of new normal or whatever, but that's kind of one foot in and one foot out of the addiction. And I think that's kind of tricky. So to me, the porn of those things you mentioned, porn is like the heavyweight of that. And so I wouldn't expect much withdrawal, honestly, if you're still using a lot of porn. The other behaviors are important part of the addiction ritual, but I think probably pulling those out of the equation wouldn't result in too much withdrawal like it would if you quit everything. So I think, yeah, maybe, but I think the porn still is gonna keep your addiction very active.
Yeah, I kind of read this question. I thought, oh, so you're not drinking beer or wine, but you're guzzling whiskey, or you're still mainlining heroin. It's like,
Yeah.
Yeah. And I don't mean to read into your question, but yeah, I mean, porn is probably from a dopaminergic and standpoint the most potent sexual.
The most part. I mean, it's right up there with cocaine, just short of methamphetamine. Porn is a really powerful drug. So yeah, I think it's something to be alert to and cautious about. And by the way, I think sometimes, and I can see I'm making this up, but I'm thinking, well, maybe I have a sex addict here who has decided sexting and seeking out other women is that, bottom line inner circle behavior, but porn is kind of a slippery slope. I can get away with porn or not. I think porn really keeps that addictive cycle very much alive. I really caution about any use of porn, and I know some people do it and say they can get away with it, but I'm really
in circle plans. I always encourage guys new to recovery, and I would with women as well, but I only work with guys, to put porn in the inner circle at least for the first 6 months, and then we'll discuss it. So just because it really will keep those addictive pathways alive, and your brain can't heal while you're doing it.
Exactly right. Yeah.
A question about the addictive cycle. How does unwanted behavior fit into the cycle? For example, in addiction, I wanted to end things with an acting out partner because I wasn't getting what I wanted anymore. But I found myself unable to not respond to her messages to me. I would try to ignore her for a while, but inevitably I would respond, even though I didn't want to see her and wanted things to end. How does this behavior of staying in a situation that even my own addiction didn't enjoy, square with the addictive cycle, which is normally presented as addictive behaviors that our addict mind wants and are obsessed with? Interesting question. A lot in there.
Yeah. So I guess what I'm taking from this is that there's still some preoccupation with the acting out partner, and very often we get caught up with our addictions where it's not giving us the effect we wanted anymore. I see this a lot with drug users where they continue to take cocaine and meth even though they're not getting as high as they want. It's always unpleasant. It's kind of too much work. It ends badly, but they're still drawn to do it, although they're not getting the reward that they once did. So I think that's still very much part of the addiction cycle. It's just we're not getting the payoff at the end, but there's still sort of a vestige of that preoccupation and wanting it. So I think it would very much fit in the addiction cycle. You're just not getting the reward to keep doing it. Now the good news about that is that may maybe make it easier to ultimately stop that. But what I would do here is kind of work backwards and really look at what is the cue or trigger or impulse that kicks that off. Is it a feeling? Is it an unmet need? Is it some behavior that is kicking that off? And I think it's like a half alive addictive behavior, right? You're not getting the payoff, but it still has some juice in it that's still pulling you in. So I would not separate it from other behaviors that you want to do. I think at some level your conscious mind may not want to do it, but I think your addictive mind probably does. And that addictive impulse can be a habit, but I think also there's some reward, if you will, some dopamine release from that whole preoccupation. You may send texts, you may not want to get the results, but there's still a little bit of connection there that's, I think, giving you a little spark. So I would really make a point to just not want to do it. I'd really try to just not do it and see, because again, it's kind of 1 foot in, 1 foot out. Scott, do you have thoughts on that?
I do. I mean, first off, there's always a hit when somebody wants you that badly, even if you're over it. It's still a hit to be, at least for me. I can't not get a hit from that. Number two, the brain always remembers the first high.
Right.
I mean, meth addicts, they talk about the first high. It's never as good as the first time, but they chase it anyway. That's the nature of addiction. There's all kinds of weird things, sometimes just getting worn down. But the things I wanted to pull out of this question actually don't have much to do with the question, but they're facts given. In addiction, I wanted to end things with an acting out partner because I wasn't getting what I wanted anymore. How common is that? Like, they're super hot, and then by date number 3, we're done.
Yeah, I think that's pretty common, in fact, because there's diminishing returns, right?
Yeah.
This has to do with dopamine, which is the star of our addictions, but dopamine requires novelty, and novelty comes very soon. So in addiction, we see this all the time with porn. The porn that we're looking at today is probably not going to be as exciting next week as it was today, or even after the first time. And so we go for something else, and usually something a little bit more taboo or kinky or out there, something more that has charge. We're going for the dopamine. And so, yeah, I think even if the same person can kind of wear thin, how many times have I worked with clients who found a hookup with sort of this anonymous person, really hot, and then if they go back for a second visit, that is not just sort of a sex object, it's kind of more of a person. They may get to know a name, they may not get a little more about them. And the more this person becomes a real person, the less desirable they become, right? Because it's no longer the fantasy, it's like starting to be a person taking shape. And that often, for a sex addict, that they lose interest in that because they're looking for the novelty and also the safety of kind of the anonymity of the situation too. So I'm not sure why you're not getting that anymore, but I would guess part of it is dopamine and just that we like novelty as we move through this addiction.
I'm going to tell an embarrassing story about myself, but in my active addiction, I would pick up prostitutes and take them to my house, but I would inevitably tell them in the car on the way back to my apartment at the time, you need to stop talking. Because they were ruining the fantasy. And, it was all about the fantasy. And even love addiction, where the relationships tend to last a little bit longer, it's all about the fantasy. And when you get to know the real person instead of the fantasy, that's when the love addiction relationships start to crumble and the addict starts looking for someone new, even while they're still in this relationship. And this may be a love addiction cycle that you're in. You want to get out of this one, but you got to get something newer and more exciting before you can fully extricate yourself from this. And then I'm going to go this is my last thing I'm going to say here, and I'm going to go all kind of 12-step sponsor on you. I'm going to say, why is her number not blocked? Block her number. Any sex addict, love addict, if you know that a relationship or a contact is part of your addiction, you have to block their number in your phone, you have to block it on your computer. If they get around that, change your number. You got to stop this. And particularly if you're vulnerable to at text number 10, you're inevitably going to respond. Well, don't let it get to text number 1. So yeah, last thought on that.
Great, good point. Good point.
Anything else, David?
No, I just think if we take this out of the sex context and even a drug, how many drug users have I worked with that they know it's going to make them sick, they know they're going to lose a night, they're probably not going to go to work tomorrow, but they still do it because
and
they can't help themselves.
When your dealer texts you respond. It's like, why is your dealer still allowed to text you?
Right. No. Exactly right.
No. How do you tell the differences between the aches and pains of PAWS, post-acute withdrawal syndrome, and other aches like headaches? Okay, how do you know the difference between having a bad day and having PAWS?
I'm not sure you really can tell the difference. Something like a headache, uh, I don't know that you can. I think you have to treat it as it comes. What's more obviously related to PAWS, I think, are the mood swings, the emotional outbursts, the kind of the ups and downs, the hopelessness, the anger, the depressions, a lot of the emotions, the physical stuff. I was, frankly, in early recovery, I got concerned because I was getting a lot of these weird aches and pains that I didn't have before. And that's where my sponsor kept saying, it's really part of the process. And I kind of trusted him. If they had gotten too bad, I would have gone to a doctor about something, but it's true. And the fact that they moved around every day. So I think, I don't know, I'm not a physician. I can't really say, but I would suggest that you can't really tell the difference. I would treat it as you would anything, with, over the counter Tylenol or something if it gets that bad, or Advil, but I don't think you can tell the difference. I mean, if something's really excessive, then you need to kick it up a notch and get some more professional advice. But I think it's really hard to tell. I just assumed everything that was weird going on in my life, my body, was probably related to my detox and withdrawal. And sure enough, they went away after a couple of months. So.
Yeah, my first years of recovery, I had headaches all the time. I get a headache once a year now.
Yeah, me too. I never get it.
Okay, what do you guys recommend for learning to incorporate all the principles of mindfulness in your life? Like, how do I measure how well I'm doing with patience, letting go, acceptance, compassion, non-striving, non-judgment, and trust in my own behavior? So you want to be perfect. Okay, good for you. How would you pose a SMART goal for these? Like, when it comes to telling the truth, would you keep track of all the times you lie and tell the truth? What's the easiest way to do a SMART goal for trust and being honest? Thanks. I watch y'all every week. We're glad you're here. And thank you. David.
Thanks. So I think, first of all, I think a practice like mindfulness is hugely important for recovery, and good for you for doing it and for being aware of positive things, like, and you name them: patience, letting go, acceptance, compassion, non-striving, non-judgment, trust in your own behavior. Those are all really things that are really important to be conscious of and aware of.
If you get there, I want to hang out with you, seriously.
Yes, that's true. So I think learning to incorporate that, I think just trying to apply those, for me, and I don't do it perfectly, but I think it's a matter of taking time every day to kind of connect with those things, be quiet in terms of being mindful, and I do meditation, but I think just to kind of bring those into awareness, and then I try to kind of just turn them over and practice them as the situations come up in my day. I personally, I could make myself nuts if I were trying to keep score or keep track of, things I did right, things I did wrong, with all these different categories. I think that would be, for me, such a focus on the process that it would be a dent in my own sobriety and serenity. I mean, from that. So I would think, in many ways, it's about letting go and living those principles. And so I think it's probably, if you want to try to keep track, I think probably, a daily 10th step kind of thing, where you kind of evaluate the day. What did I do right? What did I do wrong? How did it go? Where could it improve? And take measure of that. But I just know how obsessive certain addicts can be. And I would just be cautious about trying to be too analytical about all this and try to keep score of it all, because it could kind of have the opposite effect. So I really applaud you for trying to incorporate all these and be conscious of it and improve. But I would just notice. I would notice at the end of the day and be aware of patterns and trends that you might want to improve. But I think good for you for this is where we want to go. And yeah.
I have actually a very specific practice that I use for this. As part of my 11th step every morning, I ask my higher power to help me with whatever character defect I happen to be working on at any given time. And I work on one character defect at a time. And I tend to do like a whole month. So if I'm working on honesty, I'll ask my higher power, please make me aware when I'm not fully honest and help me correct myself, right away. This month I'm working on my control issues, wanting to control other people and their behavior, which I suppose is letting go, which you want to be mindful about. So as part of my daily routine, I say out loud, I ask my higher power out loud for help with that. Sometimes I'll do some affirmations around that also become part of my morning routine for a month. That worked really well with resentments, by the way. I don't try to bite off too much at one time, one character defect at a time. And that, as David said, become aware, when I say it out loud in the morning, somehow it kind of sticks in my head most of the day. And when I do that 30 days in a row, it really will stick in my head and I'll make some real progress. So, whatever works for you, but it starts with awareness. And I would say state out loud, this is what I'm working on today, and just pick one at a time. Yeah, don't try to be an angel, just pick one at a time. So.
Yeah, good stuff.
Okay, what are your thoughts about using Lexapro and Wellbutrin for antidepressants at the same time? Any danger in adding natural 5-HTP as a daily supplement? That is a total David question because I have no idea.
Yeah, and I remember I'm not a physician, but I have a lot of clients who are on both Lexapro and Wellbutrin at the same time. Lexapro is an SSRI antidepressant. Wellbutrin is a slightly different family of an antidepressant. They both are basically not mood altering in terms of having an effect or a high or something. They're often very commonly used with people in recovery, and they're commonly used together. They do slightly different things. Wellbutrin works mostly with dopamine, and it's actually increasingly used with amphetamine type disorders, sometimes in conjunction with other things, which are also dopamine based. Lexapro is an SSRI, serotonin reuptake inhibitor. So they're both very common. They both work well. They work in different ways. And so I can see them used together if there's a need for it. And I think this is where psychiatric medications are kind of an art form. There's certainly a science to it, but many of these, for whatever reason, whether we don't even understand, don't work as well in one individual as in the other, or they work great for 2 years and they stop working. So there's a lot of mystery about this, and I think you need a practitioner who can really, first of all, have a really good history of you and what you've taken and how it affected you, but also just who understands this. Now, I'm not that familiar with Natral 5-HTP. I think HTP is an L-tryptophan based supplement. In other words, amino acid naturally occurring. I don't know that much about it. I would say generally supplements can be useful. I'd really try to talk to somebody that knows. In some cases, supplements are not as benign as you might think. They can interfere with your medications. So I'd get somebody that really knows that stuff, and those are hard to find. But I think that one is relatively benign to my knowledge. And I do know a lot of people that do take supplements in addition to a prescribed, antidepressant. So I think whatever works for you, I think I would try, in terms of the supplements, probably not using it at first and seeing what happens. Although if you had experience with it already, if you're using it, if it's working well, that's fine. I think it also may be really melatonin, but I'm not sure about that. But I think, yeah, none of these to me represent real red flags. There are certain supplements, for example, that are used for depression that will interfere with HIV meds and that kind of thing really badly. So you got to really be cautious. They're not always benign. But I think talking to somebody, again, having a doctor or a practitioner who knows addiction can be really useful in this regard. So, yeah.
This next question says, I'm currently not employed while going through recovery. How much time is too much time to invest in the education side of recovery? I can read all day and join various sessions to keep away from boredom. What are other suggestions to fill this time during this transition into longer-term sobriety?
Yeah, it's a great question, because first of all, I know when not being employed can be scary, but also it can be kind of a gift, I think, especially in early recovery, because it gives you time to work on your recovery and get to meetings. Keeping in mind, it sounds like you have this awareness already that boredom and open space and unstructured time are all triggers and can be dangerous. And so I think it's really important, even though you're not going to a job every day, to create a structure plan for yourself so you have a routine and how you start your morning, how you end your day, different points during the day when you're taking care of yourself, and not isolating. I think that's the key here, is that you got to remain connected to people. I think I would be going to meetings, whether online or in person. I'd be reaching out. And you talk about learning. I think that's a great side of it. This is a good time to kind of educate yourself. And sometimes people find reading tedious for the reasons I mentioned earlier, with kind of that verbal memory. It's hard to concentrate and read too much. But there's amazing YouTube videos out there on recovery with a lot of education, and there's a lot of stuff that's accessible for people. If the computer isn't too much of a trigger, depending on your addiction. So I think it's all about balance, really to balance your time with feeding your brain, but also staying connected and watching that boredom thing, because that's really a big problem. To me, the answer is structure. So filling time, service, I think, is a great opportunity to reach out. You're connecting with people, you're doing service, it makes you feel good, it's rewarding. Educating yourself, physical activity, learning how to enjoy that. I think something like yoga and mindfulness, if you're going to educate yourself, take a course in mindfulness meditation or breathing techniques. So there's all kinds of really cool stuff like that would be a really great supplement to your recovery, and that most people don't have the time to invest in learning how to do it properly. So I think you can really, there's a lot of rich activities that you can do, but I think you have to really find a balance between sitting by yourself, filling your brain, versus combining that with working your body with exercise and staying connected with people, and through service, through going to meetings, through connection, through reaching out, through whatever that works. So finding a nice balance like that sounds like I'd love to spend a year doing that myself. All those things, taking courses and doing yoga, and it sounds fabulous. So just, but just don't drift too far from meetings. That's all, and from your program of recovery.
Yeah, and if you have a circle plan or a boundary plan, same thing, different name, which every sex addict in recovery should have. And if you don't, sign up for our level 1 work group, which I think starts later this week. I think we have a new level 1 group starting, or maybe it's next month. But you need to have a circle plan. My preferred term is circle plan. The inner circle is bottom line, non-sober behaviors. The middle circle is slippery behaviors and thoughts and feelings. And then the outer circle is healthy things you can do instead of your addiction. And the outer circle will contain things like reading education books and watching the videos and going to 12-step meetings and going to therapy. But it also needs to, go bowling with the family, take care of the yard, go to the gym, or join a hiking club, or fun things, hobbies, because early recovery for me was about filling the hours, because I had an 8-hour day job, and then I had another 8-hour day job, which was my addiction. And suddenly I was unemployed in that, for 8 hours a day, and I had to fill the day, and I didn't know how to do it. So I carried my plan, a physical printout of it, because this was before smartphones, everything was digital. And I would pull it out, not just look at my inner circle, bottom line problem behaviors, but to look at the outer circle stuff. So I would have some things to do instead of acting out. So I encourage you to do that. And if you haven't created that plan yet, please do so. It's a must for sex addiction recovery. So. How common is it for addicts to also have undiagnosed or even diagnosed ADHD?
Yeah, it's a great question. There's a high correlation of addiction and ADHD, both diagnosed and undiagnosed. The numbers range from 20, 30, 40% co-occurring. So it's very common. And it makes sense if you think about setting up somebody for addictive behavior. So I think it can be a real problem for people. I did a podcast with Todd Love, who does a lot of work with ADHD, and he's done some great work. And you can find out, he's a therapist who has ADHD, and he talks about what it looks like. He has references for a test you can take online to an assessment. There's a lot of stuff there in that podcast. But it was interesting to me, because I'm always concerned. I've treated amphetamine use disorder for a long time. And a lot of guys who are in recovery for amphetamines often have ADHD and often are prescribed stimulants to treat their ADHD, like Adderall, Ritalin, Vyvanse, and so on, which I worry about. Todd's belief is that if you truly have ADHD, your brain is actually deficient in those chemicals, and by taking those drugs, it kind of brings it back up to normal. If you're not deficient and you don't have ADHD, then those really kind of just supplement, you get the high. I still worry about it for guys in recovery, but he explains it in detail, and it's a very interesting conversation. So I'd really check out that podcast. And you can Google him also. There's a lot of stuff online by Todd Love, and he does some great work. But it's a common phenomenon that a lot of people struggle with. One of the things in early recovery, I mentioned it can seem like ADHD, and it can very much so. But we do find that once people stabilize in recovery, a lot of people are having adult onset or adult, at least diagnosed ADHD that is only diagnosed once they're in recovery, and all the other symptoms of their drug use and acting out behavior have kind of stabilized.
Yeah, I mean, that's a lot of things are hard to diagnose with addicts, because addicts look like a lot of things that they really aren't.
Like schizophrenia and bipolar and a lot of stuff, right?
Yeah. So what do you recommend when you're sexually active with the partner, but then fantasize about other sexual fantasies and women or events that lead to bad behavior? I've tried, so struggling to stay present when having sex with the partner. I've tried focusing on breathing, focusing on the partner. Wondering what advice you have. This is a great question, because this is an issue that so many recovering sex addicts run into with their partners as they move forward in recovery and the relationship starts to heal and they want to be sexual again. But how do you stay fully present with your partner and not turn it into an objectified fantasy addiction kind of experience?
Right. So I kind of conceptualize this as two different directions. One is a fantasy direction, where we're going off in our head. We're basically kind of disconnecting from real world and real people around us, and go off into our head. And even for having sex with a real person, they often become just kind of an object in the porn tape rolling in our head, right? And so it's a problem that we're disconnected from our feelings, from our thoughts, and certainly from the other person. So obviously we want to try to stay connected, and that's the issue you're having here. It's really important, I think, to try to stay connected. And there's a couple of things I do. One is eye contact, right? Staying present. If we close our eyes, we kind of go into fantasy anyway. So really being aware, and really we talk about empathy all the time with our sex addicts, and really learning how to be aware of what the other person is experiencing, learning how to pleasure that person, learning how to receive pleasure from that person, how to be aware, and really just enjoy the moment, right? And sex can be fun, it can be intense, it can be goofy, it can be, but it's real if we can stay connected. So I think that distinction of like not letting yourself get off into your head somewhere and to stay connected. One thing I've found is that a lot of people in recovery are trying to figure out, how can I generate enough fantasy that's not addictive to be aroused with somebody I care about in that transition state before their arousal templates kind of returned to what it was before. And one of the ways I think I recommend as a sex therapist is not trying to do it with a head trip, not trying to get there through fantasy and sobriety, but trust your body. Enjoy the sensations. Go try to have the physical experience, make contact. I'm probably every week I mention Masters and Johnson Sensate Focus, but it's all about connecting with each other physically. And I found that your body, even though your mind has been kind of distorted through the addiction, and we rely on fantasies that are no longer sustainable, our bodies kind of remember how to react, and they don't lie, you know. So our bodies can kind of engage. And I think if you have that trust and vulnerability, that takes work, but if you can capture that and just be aware and just have that mutual pleasure of not fantasy but physical contact, I think you'll start to really remain present and get aroused as well. But it is a struggle. I won't minimize the struggle it is, but I think just trying to really stay present and stay in the physical experience as opposed to the head trip. It's one way anyway.
Yeah, there was a chat request for more information about the circle plan. So I put a link in there to an article on sexandrelationshiphealing.com. You might not be able to directly copy this link. So click on the link, it'll open it, and then you can copy it and look at it later. So I want to get to one more question for you, David. We're not going to get to everything today. Sorry, everyone. Is a 12-step program the best way to attack the addiction? Or is therapy the priority? I'm currently working with both, but don't want to waste time if one is not beneficial. I love this question.
You know, for me, a combination is by far the best. You know, 12-step program is not therapy. Therapy is not 12-step program. They're two very different things. And I found 12-step program works clearly, but it's not the whole story, right? It's not guided by a professional. It's not, you don't really get into deeper issues. You don't see patterns. And so I think to have the therapy, the benefit of working with someone, you know, can you get sober just on 12-step program? Yeah, but it's probably going to take you 10 years longer than it would if you see a therapist at the same time. So I think really the combination is unbeatable. And then I would add a third. I would say 12-step program therapy and group therapy, because I think group is really the best healing modality for addiction. One-to-one therapy is great and important, especially for trauma work, but for actual feedback and growth and the benefit of that group experience, I don't think there's anything that can match it. And so I'd do all three if you can, but certainly I would not choose addiction over therapy because it's a false choice. You really need both, in my opinion, especially for trauma.
Yeah, I love addicts. We're always looking for the easier, softer way. Can I get rid of one of these? No.
Yeah. Neither one is a waste of time, believe me.
Yeah, none of them are a waste of time. And there is some research out there that shows the best outcomes for recovering addicts are a combination of individual therapy, group therapy, and 12-step work. And it's a significant bump when you add another layer. So yeah, do it all. Yeah. So,
it will pay off. It really will. I mean, you'll see it.
Yeah. Thank you everyone for being here. I'm sorry we didn't get to all of our questions, but we had a great topic tonight with post-acute withdrawal. Thank you, David. We will be back next week, so bring your questions with you. Get them in early, and that way you know we'll get to them. Anything you want to say to take us out, David?
Yeah, just remember that getting clean and sober is just the beginning of recovery, and but also it's going to take a while for everything to kind of shake out. So just be patient.
Awesome. Thank you. Good night, everybody.
All right. Good night.